I've developed a concept called outcome resistance and process resistance. And outcome resistance, you can think in terms of the idea of a magic button. And say to the patient, suppose there's a magic button here on the table, and if you press that button, you'll walk out of today's session in a state of euphoria with no effort, and all your problems will disappear. If it's depression, your depression and self-criticism will disappear. If it's anxiety, all of your fears will instantly disappear. Will you press that button? Well, the patient always says, yes, I'll press the button. And then you say, yes, but I can think of some good reasons not to. And then you begin to talk about outcome resistance, the part of the patient that's actually, in the case of anxiety, afraid of a good outcome. And outcome resistance for anxiety has to do with magical thinking. Almost all patients with anxiety, on the one hand, they're suffering terribly, whether it's panic attacks or OCD or phobias or whatever. But on another level, the patient thinks that the anxiety is helping them or protecting them in some way, and that if they gave up the anxiety, something terrible would happen. I can give you an example of that if you want.
Sure.
A young man came to me in Philadelphia with 6 months of classic post-traumatic stress disorder. He'd been working near Temple University, which is a violent area in Philadelphia. He was working in a Burger King, and he was the last to close up at night. And just before he closed up, 2 armed gunmen came in and kind of sadistically robbed the place. And before they left, they threw him into a walk-in freezer and locked him in there and left him there to freeze to death, and went out laughing, you know, at what a clever thing that they had done. The next morning, the manager came in early, saw the doors open, the lights on, realized that something was wrong, opened the freezer and found Sam huddled but still alive and traumatized from this event. And then he recovered physically, but developed all the classic symptoms of post-traumatic stress disorder, very, very severe. In fact, when he came to me, he said that pretty much 18 hours a day he was having flashbacks of the event, terrified that he'd run into some violent people and get mugged again, along with rage attacks, where he would imagine finding these men and killing them or getting revenge on them or having them arrested. He would also wake up in the middle of the night with panic attacks and rage and this type of thing. And he asked, is there any hope for someone as severe as me? And I said, hey, you know, we've got new techniques, we've got cognitive techniques to change the thoughts that are creating the anxiety. We've got visual imaging techniques to help you change these catastrophic daydreams and flashbacks and images in your mind. And the prognosis is actually positive. In fact, not only is there a good chance we can reduce your anxiety, there's a really good chance we can make it disappear entirely.